Hi, this is Dr. Lokesh. I am presenting today about criterion referenced scoring. I'm going to share the presentation. So criterion referenced test for theory and final examination, pass fail. FAT exam, format assessment do not have a pass or fail. Most of the examination, board certification examinations in ESA, all medical specialties, surgeries, are criterion reference test. So what is the criterion reference test? Where did I learn? I learned first this from Dr. Peter Christopher Katz of yes, and he's president of CEO of NBME. They are the ones who conduct the USMLE examination. They are the NBME established now more than 100 years, 1915. They do continuous research, continue item training, and so he visited NBME office in India in December 23, sorry, 23, and that's where I learned first criterion reference. And Dr. Peter Christopher is here, and other members are also here, visited our NBE office. So what is the criterion reference test means? This means that these exams are scored based on predefined set of standards. As long as student comes to the standard, they will pass, rather than comparing individuals to candidates performance to the other candidates, which is called norm reference based. That's what some people, some examination they use. So I'm going to share with you percentage passing here in ESA. Most of the board examination, if you look at the average, 90% of them pass. I think that is the same thing even in India, approximately MDMS, 90% pass. I think DNB have a little bit lower percentage pass. And student will not complain if you give 90% pass. It's not how much percentage, how much we train through the FAT every year and taking the normal standards that met the standard. If the test is based on criterion reference test like USA, and I'm just showing the data. So we're only suggesting this to passing the exam eventually for DNB board specialty, super specialty, NB MS diploma and fellowships, and of course eventually to NMC MD MS2. And but we're not really suggesting for PG needs super specialties. India doing great job. I think they should continue, whichever the method they follow. What are the couple of examples of criterion based, like driver's test? You're going to make sure that skill enough to graduate for driver's license. That's criterion reference. In USA, if you look at the examination, citizenship exam, as long as they know history and government, they pass the exam. For example, in India, if we have a military person, first they want to pass physical exam, or police officer need to physical exam. As long as they run certain amount of distance in certain time, they are eligible. So they can practice as much as they can practice until they met that how many minutes, how much time they run, distance they run. They are all eligible for physical test passing exam. Those are also criterion based. USMLE examination. USMLE examination is also criterion reference based. It is designed because he mentioned that Dr. Peter mentioned that criterion reference is what USMLE used, meaning that examining performance on the test rated against objective standards. But in residency in USA, Prejees, they not only take the exam score, but they also look at the interview, they also look at the professionalism, publications, and clinical rotation. But in India, it's different. We need to only base on scoring. So American Board of Pediatrics, again, look at this. Pediatrics must have to practice safely and effectively. That is their cutoff. And the meeting certain standard of proficiency. Who will set up the standard? The board will present. I'm going to present some another presentation about how they work as a pediatrics or other specialties as a board and how do they select some process. So American Board of Examination does follow the criterion reference test. And American Board of Radiology, actually, they have a nice website, and you can visit them, and it will show you how they follow. They use the criterion reference scoring. They also, in their website, I'll show you, they give information on norm-based scoring is not what they follow. It's focused on how well test taker performance. Criterion based, on the other hand, exclusively focus on test takers passing or failing. And if test takers met the standard, they will pass, regardless of how well they perform compared to other peers. So there's no compared to other students. They have to meet the standards. So here is the criterion reference based. This is where they put the standard set by the board. As long as people pass the above that, they will pass. Below that set standard, they will fail. But norm based, they take the average of best student and best group, and then they graph against it. So that's not the method they follow in boards examinations. So this is about the norm based, because they take the assessment students' results as compared to another, typically norm group they call. Either could be large group or massive group sampling, and then representing a diverse and broad section students. Such a group could include students of same class, students who took the same course last year, other colleges and universities. And the goal of norm is assessment is generally sought students and not assess their achievement towards some performance criteria. So that's why most of the boards, they took the criterion based rather than norm standard based assessment. Board of surgery, again, follow the same thing, criterion based. So I'm going to stop. Thank you so much. I just want to present regarding the criterion based information here. Thank you.